Most of us know an epidural as being that thing pregnant women get when they're going into labor, but actually, injections of any number of medications or anesthetics can be delivered to your epidural for many reasons. And as with anything else having to do with the spine, an epidural injection carries risks. But here now with a new and improved delivery system is Lior Margalit, the CEO and co-founder of Omeq Medical. Thank you very much for being here.
Thank you very much for inviting me here. Thank you.
It's my pleasure. So, okay, first of all, what is the epidural?
Okay, so epidurals is a common procedure with tens of millions of injections that are done annually worldwide. And it's intended in order to provide pain relief, like you said, the injection that we are familiar with for women that give birth, and also to provide regional anesthesia for patients that are undergoing surgeries.
Okay. So, and then what are the risks really related with that? With that sort of procedure?
So now the problem with the epidural is that it's done under a subjective technique, under a blind technique. Now, in order to do an epidural, the physician needs to gently, very carefully insert a needle into the epidural space, which is a very small cavity, only 2 to 4 millimeters wide, that surrounds the spinal cord. Wow. And you need to carefully, not insert the needle into the spine. Now, the nature of this technique is that the success of this procedure is based on the operator, and in up to 30% of the cases, the needle is just misplaced, so the procedure fails.
So nearly a third of every time a technician puts a needle into your spine, they miss.
Yeah, and they need to do that again, and in many cases, the needle also is puncturing the spine, so complication may occur.
So, okay, so what is your device? How does that work? I mean, I see.
The device is a smart device. It includes a sensing element and a small chip. It's naturally installed between a standard epidural needle and a syringe, and it's measuring the tissue resistance in order to help the physician to detect this dramatic moment where the needle needs to be inserted into the epidural space.
That's incredible. And and I understand you have like a crowdfunding going on.
Yeah, so actually now the company is focusing on raising funds, and we're doing it under Exit Valley platform, which is a very amazing website or platform that enables ordinary people to participate in the potential and the success of the company. And you can see it, Google it on Exit Valley Omeq Medical, and you can see all the details there.
All right, well, Lior, thank you so much for coming in. This is amazing, and I can't wait to see everybody using it to cut down that third that you were talking about.
And one more important issue about the company is that the company was first founded in the Trendlines Incubator, which is a very leading incubator in Israel, and also was supported several times with the Israeli Innovation Authority.
All right, well, thank you again for coming in, Lior Margalit.
Thank you very much. Thank you very much. It was a pleasure.